Hi.
Hi.
Hi. I'm a nursing student on the floor today. My nurse went on lunch, but I have a couple questions. Do you have time to answer them?
Yeah, of course. Take a seat.
Thank you. So, last week I was in the operating room.
Wow.
Yeah, it was really fun.
Awesome.
And one of the nurses asked the patient if he had a family history of MH, or a history of adverse reactions to anesthetic agents. What is MH?
You know, that's funny that you should ask because I recently put together a short lecture on malignant hyperthermia that I plan to lecture to a senior class next week. You can look through the lecture with me and I'll explain as we go.
Great! That sounds great.
So, malignant hyperthermia is an autosomal dominant disorder that causes an extreme increase in body temperature and muscle rigidity.
Oh, that does not sound good.
It's not.
How does that happen?
Well, there's certain anesthetic triggers that initiate an excessive release of calcium within the muscle cells. You know what calcium does, right?
Yeah. It makes the muscles contract.
Correct!
Yes!
And an excessive release leads to prolonged muscle contraction and eventually the production of heat, acidosis, and muscle cell breakdown.
That makes sense. And you said that there were specific triggering anesthetic agents?
Yep. Succinylcholine is one of them.
That sucks. That's a muscle relaxant?
Wow. Those UCLA professors sure prepare you guys.
Oh, yes, they do.
But that's right. The other triggers are volatile inhaled agents. You can check the slide I made to see the specific names of those drugs.
Oh, okay. And is malignant hyperthermia a common reaction?
Well, as you could see by this graph I made, the mortality rate has decreased significantly in the past 50 years, from nearly 80% to 5%.
Wow.
Also, it only occurs in about 1 out of every 50,000 general anesthesia procedures among adults, and 1 out of every 15,000 among children.
That's not very common at all.
True, but when it does occur, nurses and physicians need to be ready, because the results could be fatal.
What are the signs and symptoms of MH?
There are many signs and symptoms, but some of them include high fever of about 105 degrees, muscle rigidity and stiffness, tachypnea, tachycardia, hyperkalemia, and a few more listed here.
Okay, that makes sense. So how can we avoid malignant hyperthermia in the operating room besides asking for family history?
Well, besides obtaining a thorough patient history, early recognition and prompt action are key in order to promote safe patient outcomes. Also, it's important to make sure our staff feels confident in recognizing and treating MH, because once you recognize the signs and symptoms, you have to act fast. Malignant hyperthermia occurs suddenly and affects multiple body systems simultaneously, so another important factor in MH care is to prioritize treatments. Can you think of any treatments for MH?
Well, I would first stop the surgery and stop the anesthetic agents, and then I would treat the reaction. And I'm pretty sure, are there medications to administer to slow down or reverse the reaction?
You're absolutely right.
Yeah!
The drug of choice is dantrolene, and it should be administered within the first 5 minutes after recognizing the symptoms in order to reverse the hypermetabolic state that initiates the deadly MH cascade. You want to administer this drug IV push, and be sure to dilute dantrolene with sterile water before administering to the patient.
Okay. And I'm assuming that we also want to give the patient oxygen?
Correct again!
Yeah!
We hyperventilate the patient with 100% O2 and administer fluid in order to preserve the patient's kidney function. What do you think the last step in the treatment process is?
Patient and family education about malignant hyperthermia in order to avoid future reactions. And I think you should also monitor the patient throughout all of the interventions.
Perfect answer!
Thank you.
Do you have any more questions?
Yes, I do. So I know that there are crash carts available if the patient codes, but do they have similar crash carts for malignant hyperthermia crisis?
There is.
Oh.
It's called an MH cart.
Oh.
Here's a list of the different items included.
Uh-huh.
And as you can see, dantrolene is listed as well as an IV start kit and normal saline to administer sufficient fluids to the patient. In addition, an EKG monitor, blood pressure cuff, temperature, pulse ox, and capnograph are also provided in order to properly monitor the patient. Each year, MH competency training takes place that includes hands-on mixing of dantrolene in order to properly prepare the staff in responding to an MH crisis.
Wow, that makes so much sense. I feel like I learned so much. Thank you so much.
You're welcome.
You know, I'm actually considering working in the OR. So, do you have any recommendations as to how you can avoid an MH reaction in the OR?
Well, we could take a look at this chart that I made.
Awesome!
As you overheard in the OR during your clinical rotation, it's definitely important to ask about the patient's family history regarding MH or any other adverse reactions to anesthetic agents. For those who may be susceptible to an MH reaction, it's important to conduct certain diagnostic tests and use non-triggering anesthetic agents under general anesthesia. We could take a closer look at this card. You always want to make sure that the MH cart is stocked with the appropriate items in case an MH reaction does occur. Keep in mind that local and regional anesthetics are safe to use for patients who are at risk for MH, and that alternative agents are also available to use. Finally, it's important to just be aware of the signs and symptoms of MH and be prepared to follow treatment policies should a reaction occur.
Thank you so much for all of your help today. I have definitely learned more about malignant hyperthermia, and better thanks to you, I will be prepared for any questions that may come up.